So it's been a while since we've had one of these podcasts, but we got some good positive reception after the first episode, which was with Sophia. So I thought, hey, I'm on break, we have some time, and I think it's a nice time to have another conversation for the common denominator. So joining me today is actually an old friend of mine. He was an executive for the Common Denominator the previous academic year, and he was serving as the vice president for external affairs. And I've known him for a while. He wasn't actually in the same program as me, exercise and health physiology. So he's well spoken on kinesiology and understanding human integrative physiology. So joining me today is Shaine Jivan. After kinesiology, he joined the Faculty of Medicine at the University of Toronto, where he's practicing in the physician assistant program. So Shaine, how are you today?
I'm good. Thank you for having me. I'm really excited to be a part of this podcast. I've been, like you mentioned, I was part of the TCD execs. Been standing from afar and just watching how it's progressed. Really proud of, what you guys have done so far and continue to do.
Yeah, you were a part of TCD right at the get-go. Like, this is when we were developing the idea and actually bringing into fruition at the University of Calgary. So I guess from a person who's been seeing it from that perspective, how do you feel about TCD's growth?
Yeah, I mean, I think this last year has been really hard for you guys just because a lot of what we did is like face-to-face interactions, right? And obviously now I think you guys have transitioned very well to like YouTube Live and doing Zoom conferences and still trying to get the message across. Um, Obviously that poses its challenges, right? Where you can't meet face to face, you can't really advertise like you would in the university. But I think it's been going as well as it can, right?
Yeah, it's always this weird compromise because, like you said, one of our first events was very in person. You probably remember that exhibition, and there's this element of face to face that you can't replicate online. But I think initiatives like like for example, this podcast, is a good step in the right direction. So I'm really glad you joined us today. I think we'll have a pretty interesting conversation.
Yeah, I mean, it's my first podcast, so I apologize if if I have some difficulties getting my points across. But yeah, I think it's a very interesting medium, and very different from what we have done in the past.
No, I think you'll be fine. It's an early morning for both of us, and I'm already stuttering only a few sentences into it. Okay, let's talk about a few things. The first thing is I introduced you, but I want you to introduce yourself. So why don't you tell the audience a little bit about yourself, and we can go from there.
Yeah, so I think you got a pretty good grasp of what I'm doing in my life in terms of academia. Currently in my final year in the physician assistant program at the University of Toronto. But I think before all of that, if we want to try and get a better understanding of just my background, in particular to like TCD and this podcast that we're having today, is more so on my identity and a little bit more on my upbringing. So for those who don't know me, um, my dad is of Indian descent. My mom is of French descent. But on my dad's side, they were actually, well, his great grandparents were brought to East Africa. So myself, I was born in East Africa. My parents met there. They then moved to Toronto and then to Calgary, where I am now. So I think when it comes to this talk in particular, and bringing up kind of interfaith, interracial, it provides a different lens almost on how to approach
Mhm.
the kind of issues that we talk about with TCD.
Yeah, because, well, like you said, there's something really interesting because obviously there's the whole multi-race component as well, which obviously comes with its own unique insights and perspective. But I guess related to the types of dialogue that TCD has, I think what doesn't often get talked about are multi-faith lifestyles or upbringings. So you probably just said it, but let's clarify. Do you mind sharing the faith of your parents? Were they similar?
No, so they are different. So my mom was raised as a Protestant Christian, and my dad was raised as an Ismaili Muslim. So, um, yeah, both religions of, of the book, you can say, but very different in kind of how they're portrayed in media and just how they're lived, right? Um, so like that was always a very interesting talking point whenever I met someone new, was okay, first of all, where are you from? Because ethnically you look a little bit ambiguous. And then secondly, like what are you yourself? Like what religion do you follow? And so growing up, that was always a very interesting kind of area just to talk about, right? Because I think a lot of people, and especially moving to the West, it's almost very important that you identify with a certain thing, right? That you fit almost in a box. And if you don't, everyone around you is going to try and ask and probe a little bit more about why you're doing what you're doing, and what you are exactly, right? So a lot of the questions that I got was, okay, so what do you practice yourself? And growing up, that was obviously a very difficult subject, just because like I was still a kid. Like that's such a huge question for a kid, so early on. And so I think now where it allows me to see is that, you know, even in the same household where viewpoints, between a married couple can be super super important if they want the marriage to last. It's worked out. My parents are still together. I loved my upbringing in every way, and I was able to navigate being brought up in a multi faith, multiracial household.
Yeah, yeah. So I'm gonna probe into that idea because you mentioned they're living together fine. It's a happy marriage. But it's interesting that we kind of in a world where we need to bring that up because quite obviously we see around the world various places and there's so many faiths that are just not getting along with each other. So there's clearly some different dynamic here. I'll come back to that in a second. But you mentioned something really important as well, which was, I think, and I think you're fundamentally right. It's that there's some insistence on the side of society on the West where you need to be put into some type of box. Like you're this identity, whether I look at or I make an estimation of your faith, I look at your skin color or whatever you are that. And essentially, you come with all the ups and downs that box comes with. And, I'm a little guilty. When I first met you, I think I asked you that same question because to some degree, I can look at you and perhaps I could be wrong, but at least I can look at you and take an estimation at race. But faith, it's something that you believe. So that's why I think people are so interested is kind of like you grew up in this family where you had the choice to just believe a certain way. Which one did you choose? So, yeah, go ahead.
Yeah, so I think that's a really good question. I think the answer isn't as clear as I think most people would like it to be. But I think what growing up in like an interfaith household, what my parents did a really good job on was never really pushing a certain agenda, whether that was through my dad's religion or my mom's religion. It was more so, okay, we'll expose you to both of them. Um, See what you can relate with, see what you can't relate with, and then when you are older and ready to make that decision, you can make that decision. And that's something I'd definitely like to try and emulate in my future family, where in the West and in lots of parts of the world where, you grow up in a religious household, it's almost like expected for the child to follow it no matter what, no questions asked, right? And I think that puts a lot of pressure on the children. Obviously, there's both sides to that argument, right? Where one side you want to have the views of the parents, like in anything, whether it's religion or your interest, almost rub off on your child, right? And they're a reflection of what you are. But then on the other side, eventually, like anything, like any interest, you reach a point where you need to make that decision for yourself. You're not making that decision for anyone else, but you're doing it for yourself, right?
Yeah, yeah. Yeah, no, that's a really good point. And it's interesting when you think about how potent something like faith can be, because you could see, or you could imagine that in the conceptualization of your parents, the religion they follow, almost by definition, is the reality of the world itself, right? So if they believe in God, they believe that the entire universe, to some degree, is created or maybe or monitored by this God, right? Um, and you could imagine there's a bit of a drive to teach that to your parents, because if you think that something is fundamentally truth, then what you're doing is, in your subjective interpretation, you're truth telling. So, but I think you bring up an important part, which is that it's always interesting to look at how different, whether it's, like parents in a household like this, or communities in a nation, or even nations themselves, it's that how do you have this type of dialogue? Maybe even it even is dialogue on, hey, I think my religion might be useful to you, but how do you hold that in a way where you're not imposing, right? And I think that's what separates technically the fundamentalists from the people who actually hope for the other person to learn for themselves, because that's really what it's all about.
Hmm. Yeah, I totally agree with that. And more so, um, here in the West, when like we talked about it a little bit earlier, on trying to fit in a discrete identity almost. Um, if you didn't, so like growing up, we'll just take a step back. Growing up, it was often, friends of mine or people around me just asking, what I am, what I believe in. And if I don't kind of fit the same stereotype as what most people thought I was, then it's more of a reminder of not what you are, but what you're not. Right? And so because of that, and I'm not trying to bash my childhood or anything. I'm very happy with how it was, but it's just like a different perspective and a different lens in how to approach these type of problems. And like you said, it's kind of like my family is a little bit of like a microcosm of what the reality is. Right? We have two kind of very different sides, but I'm proof that they can coexist peacefully, right?
Yeah, yeah, as it should. And, we're going to come back to this, but so I have my next point here that I wanted to discuss with you. So obviously there's well, we've talked about potentially the risk of misclassifying faith, right? But then there's also this element that, and I know we wanted to discuss. Both of us have healthcare backgrounds. Both of us were in exercise physiology, where we covered a lot of this stuff. So one of the things I came across, to some degree, is, well, this argument maybe could be made based on faith. We can get into that some other episode if you'd want. But even at that level of regions or race, and sometimes a certain region predominantly has a certain faith, so there might be some correlation in there that we haven't yet teased out. But one of the things I've understood, me being a South Asian and your father who has a South Asian heritage as well, there seems to be a lot of overrepresentation in the wrong sides of healthcare. And one of those sides is cardiovascular disease. I'll go into that later, but I'm going to probably turn it over to you because that's an interesting topic. I don't think we usually talk about South Asians too much as far as as an independent risk factor for example, cardiovascular disease goes. And I wonder if that, like, what role of that is that? Is it environmental? Is it genetic? What's happening there? So why don't you break it down?
Yeah, so I think you bring up a good point where the literature in the past 40, 50 years has been predominantly produced and really looked at on European backgrounds, right? So outside of that, when we think about South Asians, I think a lot of the literature in the last 20, 30 years, there wasn't really the separation of what types of Asians there are, right? So Asians was kind of grouped in all together as South, East, West, everywhere, right? As grouped as one kind of population. The issues in that is that not only at the genetic level is there huge differences, but also in an environmental way. So I think this kind of touches a bigger subject on more genetics, epigenetics, and I guess for those listening who aren't epigenetics, what's that? So genetics itself, I think a lot of people have a decent understanding that it's kind of the cards that you're dealt with. It's your building blocks. Your mother and father pass on to you. Now, epigenetics is a very interesting area of science where these genetics, these building blocks are what you have, but depending on what it is that you're surrounded by, your environment, there might be certain triggers or suppressors that will turn on or turn off certain genes. And what does that mean? What's the outcome of that? So in individuals, who have a predisposition to breast cancer, let's give an example. There are certain genes that are associated with a higher risk of breast cancer. So that's one thing. But then on top of that, there's certain lifestyles that you can add on top of that that can further your risk or increase your risk more. And so I think coming back to this South Asians example when it comes to cardiovascular disease, we have a really interesting dynamic where, okay, I think at a genetic level, they may be at a predisposition for greater risk, but then also at an environmental level, when it comes to things that they eat, their physical activity levels, whether they're drinking alcohol, smoking, that sort of thing.
Mm-hmm. So, yeah, so I'll stop there. So now, just for a little bit of a data throw at the audience who's maybe not convinced. So Shaine brought up an interesting point. There was quite a substantial bit of literature for a long period of time, and to some degree this sometimes still does happen, not as commonly, but there's certain things where unless you separate South Asians from other parts of Asia, you're not going to see a risk, because there's other parts of Asia that lead relatively healthy lifestyles. And you could imagine that if you have one group that has high risk and one group that has low risk, it kind of averages out to not too risky. So that's really important to think about with South Asians. And another thing is it's very consequential. South Asians comprise 1/4, roughly, of the entire globe's population. And that's something that's not really thought about. And as well, it's the largest visible minority in Canada. So us as Canadians, and potentially people like us who are going into healthcare, we have a responsibility here, quite a big one. So a question might be, it kind of comes into this, is, okay, there's genetics, there's epigenetics, which one do we blame? And like Shaine said, you kind of have to give the devil his due in both. And the reason being is, okay, we know there's a genetic element. South Asians we'll talk about this later in a bit, but we pack fat, we store fat differently. And yeah, well, I'll get into that later. Another thing is that, there's some studies in the UK. I don't know if you know, Shaine, but they showed that certain markers for like increased risk of diabetes, like lipoproteins, blood sugars, they were finding in kids as young as like 8 to 10 years old at a higher risk than the general population. Now, fair enough, we don't know if that's entirely environmental, but you have to realize these studies were adjusted for BMI, right? So there could be a genetic element. And then the third thing, to give a little more of a talk on epigenetics, is that it seems as though these changes in the health demographics of the South Asian community seem to be coming with this shift towards urbanization as well. And I know we'll touch on that later as well. So I just wanted to bring up a few of those things and then use that and anchor it into a leeway and to talk on one of the things you mentioned, which was diet. Now, yeah, why don't you, I mean, your father's South Asian, right? I don't know, you probably have an understanding to some degree of what might be happening, what might be a problem for the South Asian community there.
Yeah, I think inherently South Asian food, while it is probably one of my favorite cuisines,
Delicious, yeah.
might not be one of the healthiest cuisines that we can fall back on. So, very heavy in carbohydrates, and then in particular, probably one of the biggest risk factors is the use of butter and fats in almost anything, right, of South Asian heritage when it comes to culinary kind of topics, right? But interestingly, I think there is a very unique dynamic when it comes to when we're looking at South Asians who are living in South Asia versus immigrants or migrants that are now living in the West of South Asian heritage. So, where are the changes in their diet there? So, a few pieces of literature have, and the data is a little bit mixed, I'll give it there, but overall, the kind of general takeaways from it is that these South Asians who have migrated to Western countries have an increased consumption of foods that are unhealthier. So, things with, higher fats, more refined carbohydrates, all those things lead to increased cardiovascular risk. When you want to talk about diabetes, also, that's a huge risk factor for all of those things. So it's interesting when, the literature itself in the last 40 years, which I kind of touched on before, is predominantly on European ancestry, right? And studies have shown that when it comes to diabetes in Europeans, there's probably around 60 genes that we can link back and forth, right, between Europeans and development of type 2 diabetes. Now that's just in Europeans. We don't really know what that genetic predisposition is in South Asians, right? So it'd be really interesting, and I think there's almost a need and a push for understanding these populations much better, right? So coming back to what you were talking about when it comes to diet, particularly in refugees, that's another really important and interesting topic, right? When individuals of refugee status immigrate to Canada or to America, in general, they're going to be of low socio-economic status. So where does that put them in terms of getting a diet that they need, right? So I think when you take a refugee out of their country where they may have been on their stable diet for generations, right? And you take them out of that and place them in this Western society where already they're starting a foot back because they can't afford, maybe some of the foods that they were able to access with such ease in their home nations, but already now they're starting off with these junk food type nutrients, right? Because that's what's affordable. So I think that itself can cause so much havoc in the future, and it has at the moment, right?
Yeah, yeah. And well, that need you're talking about. Um, well, actually, I'll talk about the refugee communities. This is what Sophia and I talked about on that first episode. Is imagine the effect even COVID has had. You already have a group that may not even speak the language our country speaks. They're kind of in this this new foreign alien nation, and all of a sudden you're saying, well, you gotta stay at home or else this virus is gonna kill you. And it wasn't, I mean, like, it's not like it was communicated any better than that to these communities who essentially just relied on their own social media to tell them what's happening in the language that they comprehend, right? So that's the first thing. And then this other thing you talked about, like that need to help these people. So I was looking at this systematic review meta-analysis that came out on in the UK. The UK seems to be ahead of us when it comes to South Asian health. That's definitely the case. But they were saying that relative to the increased risk of this cardiovascular risk, which, by the way, its mortality rate is very, very high. So for people, to give you an understanding, it's around 200 and 100 per 100,000, right? So to give you an understanding, and we always hear on the news about, different types of homicide and murders, that would be 2 in 100,000. So now I'm not suggesting that 200 of those 100,000 were preventable, but at least some of them were. And even if some of them were, we could potentially stop enough unneeded CV deaths as which would be equivalent in number to all-cause homicide, just to give you an example. And for people who, maybe we should define our variables. So cardiovascular risk usually refers to cardio, so you have heart disease, coronary artery disease, any cause of heart disease. And then you also have vascular, so strokes. But interestingly, like Shaine mentioned, hypertension, diabetes, and these things are commonly or disproportionately high in the South Asian community as well. So anyways, that meta-analysis basically said that based on their risk, there is the least amount of resources that are trying to tackle that issue relative to that risk. And it was basically saying that it almost feels like the society doesn't really feel a need. Because, I mean, I don't know, it feels like, at least from a research perspective, maybe it's not fundamentally in stone, but we have quite a significant suggestion of a major issue, and yet no funding for focus groups, no funding for any South Asian specific education or clinics or advocacy, none of that. So that's something that, I think there's a lot of room to figure that out as a society.
Yeah, and I think going back to what you were saying, since we're just speaking about the literature, and we had chatted about this a few days ago, but BMI and BMI in South Asians and what it means compared to, maybe what we've been taught in university in our courses. I don't know. Do you want to touch on BMI and kind of how that plays out in South Asians?
Yeah. So, there's a few studies that talk about this. So, one thing to talk about in terms of BMI is just to talk about the obesity paradox, as I like to call it, anyways. I mean, usually when you imagine obesity, you imagine a lot of fat, and you essentially visually ascertain to some degree if someone's obese. I'm not saying clinically, but generally in society. But South Asians have a tendency of two things. One is less subcutaneous fat, which is the type of fat that you see like right underneath the skin. It's more visible. And then one is and more visceral fat. which is underneath. It'll be lining your organs. So for example, it might line your liver and give you fatty liver disease. All right, so that's the first thing. The next thing is that South Asians tend to pack fat centrally. And we all know that central adiposity is related to a lot of these risks, risks for a lot of these things that we've talked about. Now, I think what you were getting at was that in BMI studies, which fair enough, not particularly useful for individuals, but population level, they're okay. And usually the BMI cutoff is around 30 kilograms per meter squared for like, let's say, Caucasian male. And we'll say roughly at around that cutoff, you're at an significantly increased risk for XYZ. Now, for South Asians, there's some preliminary studies in the United Kingdom that suggest that that same BMI cutoff for example, cardiovascular risk, or I think maybe in this case it was diabetes, but we know that a lot of these things tend to be linked anyways. Yeah, so that same cutoff was 21. Now, for anyone watching this, you can probably see that I'm not too particularly lean, or I don't have too much what people would consider to have too much subcutaneous fat. In fact, most people would look at me and go like, hey man, you're kind of skinny. But my BMI at this time is 21, right? Like roughly. And that puts me right at that edge, pretty much right on that cutoff of what might stratify me into high risk. And I think it's really important to know this, because it tells you that, well, no, we shouldn't look at other people's body types and try to emulate them. And another thing is, if we are reaching into what we can now classify as a danger zone, we need to have an intervention. One of them we talked about. Let's start with diet. But another thing that I probably have you comment on then is exercise, right? And I feel like from the get-go, maybe it's because when you turn on the TV, you don't see any South Asian athletes. Maybe it's that. I don't know what it is, but there definitely isn't a focus or a big focus on exercise for South Asians, at least in the West, and like back home, people play cricket and soccer 24/7, and even their daily commute is just ridiculously long, and it's all by foot usually. So yes, here's some about exercise.
And I think that's probably the biggest difference, where back home, physical activity isn't really viewed as something that's an extracurricular. It's just part of the essential life, right? So especially in like rural areas where, you'll be farming for 12, 13 hours throughout the day. On top of that, I don't think you got to do much physical activity, just because you've done so much. So now there's this transition, especially when they're moving to urban areas or even to the West, where they might not be farmers anymore, and they might be, having some other type of job. But just from the get-go, there's never really been the integration of physical activity as an extracurricular or something that can really benefit you long term. Now, I think going back and just talking about BMI, because I think it's a really like fascinating point when it comes to South Asians. So just to offer a little bit more clarity, BMI itself, like you mentioned, really not the best when we're looking at individuals, but from a population perspective, when we're looking at big groups of people, can be quite helpful. So from what we've learned, over 30, a BMI over 30, it really categorizes as an obese individual. A BMI between 25 to 30 classifies as an overweight individual. And then 25, I think it's to 18 is really like the normal range. Under 18, then we start classifying in like the anorexia group. I might be wrong on that, but I think that's what it is. But yeah, to offer a little bit more insight, myself, I'm someone who tries to be physically active quite a few times a week. I try to keep a good diet, and my BMI is sitting right around 25. So already, looking at BMI on its own, and this is why it's kind of an issue looking at BMI when it comes to individuals.
Yeah, yeah.
But that alone is one risk, and then you add on top of that being of South Asian heritage, 21 being that cutoff. I am well into that cutoff, right?
Yeah, yeah. Well, I mean, in your case, it's if you are active, and I don't want like the viewers listening to this go like, yeah. I mean, if you are active, the chance that a lot of that BMI is comprised of muscle mass is higher too. So, and of course, muscle is metabolically active, and that's healthy. But so this is just general conversation. And I think what we're getting at, I think this is the foundational point here. For a given BMI, South Asians are at a higher risk for the cardiovascular risk or diabetes and potentially even hypertension that we've talked about. I think that's generally a takeaway. Not to cut you off short here, but since we are short on time, I want to tie this in to maybe a last thing we can comment on. And it's that, what do you think? Because when I'm in, like, or what you've probably seen this as well, different aspects of healthcare being replaced with technology to some degree. Like now we have cool laparoscopic surgeries, and in the future we're gonna have robots doing it all. I mean, there's certain surgeries right now that you could even argue a robot could do. It's just the ethics of it and all. And then radiology, we all hear about that all the time. So, what about this side of medicine, like diet, exercise, and these conservative strategies to prevent risk? What do you think about the role of technology in healthcare and in that side of medicine?
Yeah, I think that's probably that is where the future is, really, when it comes to healthcare and trying to really work on preventative medicine. Um, Technology is going to be the medium that, virtually everyone in the West is going to have access to, and I'd say now a lot of developing nations have access to. It's really people who have any internet connection, mobile phone, and it sounds crazy because 20 years ago this was the complete opposite, but now we're really in an age where technology, the use of applications that count your calories, show kind of your nutrient breakdown throughout the day, super important. Myself, just in a couple of the rotations I've been doing, the use of ECGs on like wristwear, super interesting. So as an example, last month I was working in emergency and we had a gentleman come in who had recently got, I think it was an Apple Watch, one of the new Apple Watches, and they now have an ECG function. So he was, I forget what he was doing. I think he was running around, didn't feel too well. Took a look at his Apple Watch, and the ECG looked. There's this one wave that looked a little bit different from everything else. So it came into emerge, and it was so cool being able to show us, what it was in real time, because often, a lot of the complications when it comes to that is, okay, you had a chest pain 10 hours ago, but now you're fine. I wonder what happened 10 hours ago. It'd be nice to have some sort of diagnostic insight into that. That is super, super interesting, and definitely something that's going to become more and more useful in the future, right?
Do not get me started on wearable technology. That it just excites me to the core. I think that's going to be a big aspect. And for people who are curious, like an ECG, usually they're useful during the process. So if you have the historical data, you can figure out what happened. And that's a really cool idea. And it's just going to grow from here. And while all this is true, there's a lot of potential going into the future. An Apple Watch isn't particularly cheap. And then the question kind of becomes like, who's going to get this technology? one thing I was reading, this was a while ago, I'll just keep it anonymous for this time being, but there was this one, he's rich, for lack of better words, and he was on his fourth heart transplant, right? And when I say rich, I mean like very, very rich. So these types of conversations come up, and there's that whole debate about I think it was Steve Jobs' liver transplant, right? I think that's what it was. Don't quote me on that, and I'm not making an opinion on that either. It's not an easy case. It's a lot of it's speculation. We don't know the entire breadth of the case, but these types of conversations always happen. And I think we'll finish with something like this, is that, and I'll get you maybe to comment on this as well, but it's how are we going to move forward in a way where this wearable technology will actually help the people that, for example, like the South Asian community, are actually at increased risk for certain things, right? Or is it just the people who want additional safety net that are gonna get it? And we can enter a whole philosophical debate of, well, what if they want to get it? That's okay. But what do you think about that?
Yeah, so I think a lot of that comes down to policy making from a government level, where, we owe a right to patients that whatever it is we're advocating for, there have been, trials done on the use. There is evidence that supports it. It's not, some something we're just saying because we've seen it happen a few times in real life. There is evidence that supports it. So I think the answer is very complex when it comes to particularly South Asians and trying to have better health outcomes in cardiovascular disease. It's more so, how can we target them when it comes to a tech medium? How can we target them to ensure that they're really being the things they're at risk for are being addressed, and not only being addressed from a clinician level, but also from a government and policy making level, where there are focus groups, there are health initiatives that really target them more so than the general population. And I think that is important because everyone is different. Everyone has a different way that they view their own health. And the big change in that comes from education. Like, patient education is kind of the biggest topic when it comes to preventative medicine, right? And without it, I don't know if you have very effective preventative medicine.
Yeah, very well said. And for people in medicine that are listening, when you're recruiting, let's say, for your studies on the new wearable technology you've developed, it might be useful to have a few participants from various ethnic backgrounds or faiths as well. We didn't get into that in this episode. Perhaps we can have a conversation about that in the future. But for now, I think that's about does it.
Yeah, so I'll add one more point, and
sure.
I'll just say, as clinicians, anyone who is listening, I think you almost owe a right to your patients to understand their cultures and their ethnicities, and what that is. Like, do you have a good understanding of what a South Asian diet is, or whatever diet it is, South American, whatever. You owe that almost to your patient to have a better understanding of what you're taught in school, because unfortunately at the moment in school a lot of it is taught on what has been done in the last 20 to 30 years, which is predominantly individuals of European descent, right? So I think, especially depending on where you practice, whether it's in a part of town that has more immigrants, you owe that to the patient to understand and really try and figure out how can we make changes that are applicable to them, not just the general population.
Mm-hmm. All right, Shaine. I really, really appreciate your insights today, and I'm hoping that the listeners took away quite a few things. I mean, you shared a lot of interesting insight, and I'm hoping we can continue this conversation in another episode.
Yeah,
Okay?
definitely. I enjoyed my time on this podcast, and I'll be cheering from afar, hoping that it does well. And I think it's a very good opportunity for individuals to become more aware of things going on from a faith-based perspective, but then also how that ties into other aspects of life for us, in particular, healthcare.
Mm-hmm. Okay, so that just about does it for this episode. I want to thank everyone who watched this or tuned into the audio. And if you have any suggestions on things you want to hear from the podcast, or maybe you want to have Shaine and I have another discussion on something related to this, give us a shout. We have our tcd.u Calgary on Instagram, as well as we're getting our YouTube channel started now, so hopefully we can follow up on there. But all right, thank you everyone for tuning in. Until next time, take care.